Certainly, we're a very fitness-oriented society and increasingly are more aware and concerned about our body image. And certainly diet and exercise are the best ways to achieve our ideal body shape or contour. But sometimes, despite diet and exercise, we may not be able to address certain areas. For example, in the abdominal area, some patients may be unhappy with loose or excess skin and fat in that area. Sometimes this may be related to a weight fluctuation. Commonly, I also have women telling me that they are unhappy with their body shape after a pregnancy. They notice excess skin, stretch marks, or more protuberance or prominence of the lower abdomen. And despite targeting these abdominal muscles with exercises, they find that they can still not improve the contour. And partly that is because with pregnancies, these muscles become more splayed apart. They separate. So even though the muscle is toned or may be toned with exercise, there is still a bulge or prominence in the lower abdomen. If patients have looseness of skin and excess fat, then they may be able to improve the contour of their abdomen through a tummy tuck, or also known as abdominoplasty. And this is a cosmetic plastic surgery procedure designed to remove excess skin and fat. Typically, this procedure involves making an incision in the lower abdomen to hide within the bikini line. Through these incisions, we're able to expose the underlying muscles, which have splayed apart with time. Then, with permanent sutures, I am able to bring these two muscles closer together. The effect is similar to an internal girdle, and these muscle tightening sutures will dramatically improve the contour and prominence of the lower abdomen. After this portion, we then redrape the skin in a downward fashion and remove excess skin and fat. Typically, this can represent skin from the navel to the lower abdomen. I typically have my patients stay overnight in the hospital for a 23-hour stay and then allow them to go home. Patients do feel a muscle tightness in the abdomen, but after several days, they're able to stand more upright, and by a week, they're feeling significantly better. Patients typically will need at least 2 weeks out from work, and I have patients avoid heavy lifting and straining for approximately 6 weeks after the procedure. I really find this procedure very gratifying because it allows my patients to achieve a more ideal body contour. Tummy tuck is a very common procedure in my practice, and I think my patients are happy to know that there is a cosmetic plastic surgery procedure that can really address their concerns in the abdomen.